I wanted to become a doctor because I love being able to interact with people, I love working with people, and it's a good way to be able to help and give back. Family practice I chose because it's an opportunity to kind of be a jack of all trades, get to do a little bit of everything. You're not just limited to doing surgery or just delivering babies. You get to work with kids and adults and older folks, and it's very rewarding. My treatment philosophy is pretty simple. If you take care of your body will take care of you. I'm a big proponent of exercising and eating right, and I try to lead by example. So if I do it, I don't have a problem telling my patients to do it. I wanted to practice in Wichita Falls because after I completed my residency, I moved here with the United States Air Force. And so I had the opportunity to work in the community a little bit as the facilities at the base kind of shrunk. And so at that time I had young children. We felt that this was an excellent community to raise kids. And I really liked the medical community that I had been exposed to from my time out at the Air Force Base. Preventative care is the cornerstone of what we do in family practice, and it's actually what I like doing in medicine the most. We try to follow the guidelines that we have, which give us the recommendations for different types of screening. For instance, for everybody over 50, colonoscopies are super important. Women need to have their pap smears if they're eligible for that, and their mammograms. And kids need to have their immunizations. Right, I think really the biggest thing for my practice is that I really am interested in preventative care, and I really like to encourage people to do things more naturally. Pills and injections are a necessary part of what we do in medicine, but that's not what I like to prescribe if we can avoid that. A natural method to taking care of yourself is certainly much better. So much of what we see is preventable by simple diet changes and regular physical activity. And that's where I like to make the focus of my practice. Treating the whole person is the foundation of family practice. It's what we refer to as the biopsychosocial aspect of medicine. So you don't just talk about treating disease in and of itself, because there's other factors that contribute to what's going on in a person's life. Stress at work, stress at home, interaction with other family members. And so that's what we're best at in family practice, is taking these things into consideration when we're formulating a treatment plan for a patient. One of the jobs of family practice doctor is coordination of care with specialists. So since we have training in so many different areas of medicine, we're able to interview a patient, take the history, order maybe appropriate lab tests, and then based on the information that we gather, potentially make referrals to other doctors and do it in the appropriate manner. And doing that, you build relationships with the specialists so that you can call them up on the phone, communicate what's going on with the patient, why do they need to be seen, why do they need to be seen now versus in a month from now. And so coordination of care is very important.